I have been asked to talk about the application of quantum computing in life science and medicine for about 10 minutes. Our understanding of quantum computing and its application has been evolved over time. We started our journey in 2018, exploring all the potential applications. And I could say that we have reached the conclusion that yes, the opportunity cost of not spending right now is much higher as compared to setting up a POC, right? So it is actually a high time to really explore it. But just to tell you about the potential application, actually it is ubiquitous to the entire drug discovery process, be it a target discovery to the commercialization of the molecule. And just want to give you, it spans around simulations, optimizations, and quantum machine learning, as many previous speakers have mentioned about it. But I'll just give you the brief overview about applications in different domains of functional areas of drug discovery. And that is actually regardless of which molecular entity any pharma companies are actually developing, such as small molecular biologics, or be it a structure-based drug discovery or a ligand-based drug discovery. So start with the drug discovery process. It starts with the target identification. Right? This is the holy grail of many pharma companies, in fact, all pharma companies, to understand the disease mechanism, right? Understand the disease manifestation and root cause of that, so that you can develop a molecule that can target that one. So this process is called as a target identification, and that starts with basically bioinformatics approaches such as the functional genomics, proteomics, and different GWAS and PWAS studies. So the central challenge here, and where the quantum computing can leverage here, is about the complexity of the graph data structure or knowledge graph that comes out from the systems pharmacology or the bioinformatics is enormous. So, and how to solve that? And when I say solve, it means that sometime, just to give an example, that the human interactome, right? We have got 50,000 interactions for 8,000 human proteins. So you can imagine the permutation and combination of that one, right? There has been a lot of proposals in the literature how quantum computing can help solve this one using quantum link predictions or quantum walk, for example. And the second example is about the heat identification, right? Once you have found a target, you have to find a chemical entity that could go and target, right, and silence it, or maybe some kind of activation that happens. And here the challenge is that we have got a gigantic chemical space. And the chemical space, regardless of small molecule, it is around 10 to the power 60. In the biologics, it is 10 to the power k, 20 to the power k. K means the length of amino acid. So all in all, these are NP hard problem, okay? Because and it is impossible for any pharma company to synthesize all the molecules, which is actually number of molecules are even more than the number of atoms in the observable universe, right? It is impossible. So the challenge is, how do you do in silico, right? How do you tell computer to design a molecule or select a molecule? It is kind of a fishing expedition, right? Which would have a desirable properties. And this is where the quantum will come into picture, right? Then the third part is about the lead optimization. Like once you have found a hit, how do you, optimize the property of a molecule which would be desirable for the therapy that you're looking for, right? And this is actually a multi-objective, multi-constraint optimization problems. And as you can see, many of you are quantum aware that this is actually a quantum problem need to be solved because classical are just really not sufficient to solve such multi-objective, multi-constraint problem. Just to give an example about what is happening from the quantum chemistry level, right? To really understand the structure of a molecule, right? You really need to solve the Schrodinger equations, and that we call as a full configuration interactions. And as you know, we have a limitation in the classical computer. We can only reach to the starting from the force field to semi-empirical to the DFT. DFT is our standard, right? But that is an approximate representation of a molecule. To really understand the mechanistic understanding, you really need to solve the FCI. And this is where the quantum computing can help through chemical simulations of a large molecule, formulating a fermionic Hamiltonian of a large molecule and then understand the quantum properties, okay? Just to tell you about some application, there has been a lot of application in the literature that has been discussed, such as the structure predictions, protein structure predictions, because all applications that we have so far are all data-based, meaning that the training-based, right, machine learning-based, and that is not enough. So we have some examples such as how one can solve the protein lattices structure problem using variational quantum eigensolver and the steady-state energy calculations. Also some examples like RNA codon optimization, which is very important. Also how to find the binding energy calculation. This is a very important problem in drug discovery process. And this is one of the reasons why majority of the clinical trial fails in phase 3 and phase 2 because of the off-target affinity and the less high toxicity and stuff like that. So how do you reduce this part, the attrition of the molecule in the drug discovery process? The quantum can help you with this one. And the last part is about the quantum machine learning. It is about, in healthcare or in the pharma, we are interested in finding the correlation between the in vitro experiment to the in vivo experiment, right? And this is where the regression and the classification would come. However, many of you are aware that we have, at least there is not a single publication which would say that there's a quantum advantage in machine learning as far as the discriminative models are concerned, because we have still in a hybrid approach. We haven't really solved the problem of QRAM and other stuff. But yes, I'm very hopeful about the generative models. For example, quantum Boltzmann machine, Born machine, or Helmholtz machine, where people have a lot of proposal how this can be used, how one can use a real quantum sampling, to generate the molecule that you haven't seen before. Yeah. And another avenue in machine learning is also the quantum feature maps, such as the quantum support vector machine. There is also a very nice and active avenue that people are exploring in the machine learning part. And it has a huge potential in healthcare and life sciences. Yes, I mean, these are all the examples. And finally, I would like to tell about, what is our entire goal in healthcare, right? We have seen in pandemic. It is really a challenging task to develop a molecule right from the target discovery to the commercialization. And it is because of the siloed structure of the drug discovery process. So quantum computer has an ability to reduce this timeline so that we have targeted therapy and also the discovery of the molecule and the development of the molecule in a shorter amount of time. And this comes to the part of personalized medicine. So in personalized medicine, what we talk about is how to understand the mechanistic understanding from the phenotypes of a person on which the disease is manifested, to the genomics level, to the proteomics level, and then the metabolomics level, to the real root cause. So if you see these different layers, there is a many-to-many mapping. And as you know, this is a quantum problem, right? To solve the many-to-many interactions, it is actually not possible in a classical domain. So this is where the quantum can give you leverage, where we can really go towards our goal as a humanity, let's call it as a personalized medicine. So with this, I would like to stop here, and I would be very happy to have a really fruitful discussion out of this one. Thank you very much.
Gopal, thank you so much.